Missing teeth, broken teeth, teeth that are in pain? Let's talk about some options to get that smile back. Hi, my name is Jeffrey Butts, and I'm a doctor of dental surgery. I have over 15 years of serving my community as the owner of Camp Creek Dental right here in Atlanta, Georgia. And all we want to do is help optimize your oral health and overall health journey. Today, we are talking about, people have asked me, like, what am I going to do about this, doc? All right, so their teeth have been broken, like, there's cavities and some teeth are just missing because a doctor pulled their tooth because they had a bad infection. I got people in car accidents that I see, and they just don't feel quite confident about their smile because they're missing teeth, right? So let's talk about some options that you can use in order to get your smile back, all right? So missing teeth can have psychological effects impacting your mind, right? So if I was missing an eyebrow and I was missing a tooth, more than likely when I smile, you would only see the missing tooth. More than likely. I've tested it on some people and they're like, they got a missing tooth. But I'm like, they got a missing eyebrow too, right? So it is important to people to represent themselves as best they can. And really, your smile is like your calling card. It's what people see first when they see you. A nice smile is inviting. It helps people feel more confident in what you're doing and what you've got going on. So when that smile is broken for various reasons, well, most people want to get that back if they can. So I and my team are here to help with that, all right? So you might feel less confident in social situations, avoiding a smile in photos. You might even feel anxious about speaking in public. This can lead to like social withdrawal and depression and a diminished quality of life, but it doesn't have to stay like that, okay? Teeth play a critical role in our daily lives. Beyond just appearance, they're essential for proper chewing and digestion. The first step in digestion actually is in the mouth, where the teeth break the food down into smaller particles, manageable pieces, and then when it goes down, the body's able to break down those manageable pieces in the stomach first, and then in the small intestines, right? So getting your nutrient from a proper chew is amazing. How about this? If you don't have a right bite and you're eating pieces that aren't broken down, they're big chunks, well then the body doesn't digest that very well. It can lead to stomach problems, okay? It can lead to digestive issues and malnutrition over time. But it doesn't really stop there. Missing teeth can cause the surrounding teeth to shift, leading to what's called a misalignment and even more significant dental issues down the line. It can also lead to bone loss. As a matter of fact, it absolutely leads to bone loss because there's this ridge. I'm gonna give you some dental jargon for a second, okay? The ridge is called the alveolar ridge. It is a piece of bone that sits on top of your maxilla and your mandible. This alveolar ridge only has one job, and that job is to hold teeth in place. When teeth get missing, broken, have to be extracted, or they were extracted due to trauma, that ridge over time gets smaller, or it's called it resorbs. That resorbing ridge is gonna actually make your face sink in, and it's gonna give you a different look. It's gonna change the shape of your face and make you look older than you are. But fortunately, there's several options to restore your smile and your confidence. And let's go through them, all right? So, one of them, which is a very common solution, is dentures, right? Especially for multiple missing teeth. They're removable, they come in and out, they're relatively affordable, and the only one little thing about them is that they can be uncomfortable. They may even slip out of place. They don't prevent bone loss in the jaw, and they do require daily maintenance and need to be replaced every few years. Another option is dental bridges. Basically, they're anchoring a bridge of teeth connected to one good tooth and another good tooth. Now, that good tooth and the other good tooth, they were healthy at one point. Once you take a dental burr to those teeth, now it becomes less healthy, if you will, okay? But they are able to anchor the tooth in order to cover the space, but it does not prevent bone loss, okay? But this absolutely can be a more permanent solution than dentures. In order to make them work, it does require altering healthy teeth to serve as anchors, and it doesn't address the issue of bone loss in the jaw, okay? Now, let's talk about my favorite thing, dental implants, all right? Now, dental implants are considered the gold standard for replacing missing teeth, and for good reason. Unlike dentures or bridges, implants are anchored directly into the bone with a titanium post that acts as a tooth root. This not only provides a strong, stable foundation for the crown, but it also stimulates the jawbone or the alveolar ridge, preventing more bone loss. Implants look and feel and function just like natural teeth. They're durable, they're very long lasting, and with proper care, they can last a lifetime. They don't require altering healthy teeth. They allow you to eat, speak, and smile with confidence without anything falling out of your mouth, just like you're used to, all right? The success of dental implants lies in the process called osseointegration, all right? Osseointegration is a process that happens with these two cells that we have, all right? So there's the osteoclast and the osteoblast, okay? When you place an implant, a drill goes into the bone. Now, don't be worried about this, guys. Bone does not have any feeling or sensitivity at all. You can feel the vibration, if you're awake, you can feel the vibration of the drill going into the bone, but the only parts that have feeling in your mouth are the gums. If you have a natural tooth there, yes, the tooth has feeling, but in terms of there's a missing tooth and you're drilling into the bone in order to replace that tooth, it is not, I repeat, not a aggressive traumatic procedure, right? So this osteoclast is a cell that basically chews up the bone particles as the implant goes into the bone. It has kind of like a waste product. That waste product is old bone. So these osteoclasts, like Pac-Man, they chew up the old bone. And then right behind them, the osteoblasts lay new bone in order to make the implant actually tighter than when I originally put it in. This is just basically called osseointegration, all right? It's gonna keep your jaw healthy. It's gonna maintain the natural shape of your face and prevent the sunken look that comes with missing teeth, all right? Restoring your smile is more than just a cosmetic decision. It's an investment in your overall health and well-being, which is what this channel is all about. While there are several options available, dental implants stand out as the most effective and long-lasting solution that we've come up with in order to replace missing teeth. Schedule a consultation with us and explore your options and take the first step towards a healthier, happier you. Guys, besides just taking care of your teeth, you know this health and wellness channel. You know what I gotta say if you've seen me before, okay? It is not just about flossing and brushing. Your overall health is due to the actions that you take and the actions that you don't take. Every dental implant is going to need your overall health and your overall immunity in order to have that osseointegration, that's the osteoclast and the osteoblast, so that they're able to do their work, all right? So I always say, know what your blood type is so that you can eat the proper food for you based on your body chemistry. You still want to drink enough water, and you want to take your vitamins and minerals that support your immune system, okay? You have to get proper sleep. Rest is where we do our greatest recovery. It's the subconscious taking care of the things that it cannot take care of while you're walking and talking and watching a video, right? You want to exercise. There's two forms of exercise. You want to get cardio exercise, which helps your heart, and you want to have some weight resistance training, which is actually even more important when you're younger, so that when you get older, you have the baseline in order to keep your body healthy. Lifting weights is very good because it stimulates the bones, which are where the cells that help with your immunity are produced so that they can come out healthy and strong. You also have to have some detoxification moments, and that is in the form of a bowel movement, that's right, pooping, sweating, which is excellent for you, and sometimes not eating, so that would be like intermittent fasting. And then the last thing that helps with your overall health is simply mindfulness behavior. So that's a good attitude, some gratitude, forgiveness, being kind to people for no reason at all, being kind to yourself for every reason in the world, right? And learning how to meditate, reading, saying good things to yourself. All of these things helps your overall health, all right? Which is very helpful to you, all right? So I just want to lay that back on you, because getting a dental implant is a great decision that you can make for yourself. But in getting the dental implant, I want you to also know that you are responsible for your overall health, not the doctors. You are. So get the information that you need, like at least knowing what your blood type is, and do the things that you need to do in order to support your health so you can support your great life. Okay. That is all I wanted to say about that, guys, all right? Give us a call at Camp Creek Dental. We're going to leave the phone number down there. Please like and subscribe to this channel, and we're going to talk about a couple other little things a little bit later.